Hello everyone, I am Yash Saxena and in this video we will be discussing rumen acidosis. Cattle with rumen acidity experience metabolic problems. It is vital to keep in mind that similar to most metabolic disorders, for every cow that exhibits clinical symptoms, there will be several more that are impacted subclinically. For those who don't know what is rumen, the large first compartment of the stomach of a ruminant or cattle in which cellulose is broken down by the action of symbiotic microorganisms is called rumen. When rumen's pH drops to below 5.5, acidosis is thought to ensue. Normal pH is 6.5 to 7. The pH can drop significantly lower in certain circumstances. Two impacts result from the pH drop. To begin with, the rumen stop moving and becomes atonic. This lowers output and hunger. Secondly, the change in acidity changes the rumen flora with acid-producing bacteria taking over. They produce more acid, making the acidosis worse. The increased acid is then absorbed through the rumen wall, causing metabolic acidosis, which in severe cases can lead to shock and even death. Before talking about the prevention and treatment method, I should tell you about the major causes of rumen acidosis and the symptoms. Feeding in abundance of quickly digestible carbohydrates such as barley and other cereals is the main contributor to acidosis. When cattle have access to more than sufficient feed, they are more likely to develop acute acidosis, which frequently results in death. When dairy cattle are fed more concentrates than grass, a milder form of acidosis known as subacute acidosis develops. Various factors can lead to this rapid increase of acid in the rumen. Feeding cattle concentrated feeds such as fermentable grains, switching rapidly from higher forage to feed with higher concentrate, feeding cattle a low fiber diet, the presence of mold and spores that produce mycotoxins in the body, etc. The starch will promote the growth of microorganisms that make lactic acid when there is sudden switch to a diet high in starch and sugar. The rumen's pH will gradually drop as a result of the problem, leading to acidosis. When acidosis is acute, causing a rapid spike in acid production, it results in debilitating illness that can include liver abscesses, sometimes resulting in mortality. It is also not uncommon that cattle will develop scars and have an elevated heart rate. The most common symptoms of acute ruminal acidosis include lethargy, elevated respiratory and pulse rate, increased temperature, diarrhea, weight loss, decreased feed intake. The key to prevention is reducing the amount of readily fermented carbohydrate consumed at each meal. This requires both good diet formulation, proper balance of fiber and non-fiber carbohydrates, and excellent feed bunk management. Animals consuming well-formulated diets remains at high risk for this condition if they tend to eat large meals because of excessive competition for bunk space or following periods of the feed deprivation. Feeding excessive quantities of concentrate and insufficient forage results in fiber deficiency. Results in a fiber deficient ration likely to cause subacute ruminal acidosis. The same situation may be seen during the last few days before parturition if the ration is fed in separate components. Including the long fiber particles in the diet reduces the risk of subacute ruminal acidosis by encouraging saliva production during chewing and increasing rumination after feeding. However, long fiber particles should not be easily sorted away from the rest of the diet. This could delay their consumption until later in the day or cause them to be refused completely. Ruminant diets should also be formulated to provide adequate buffering. This can be accomplished by feed stuff selection and or by the addition of dietary buffers such as sodium bicarbonate or potassium bicarbonate. Dietary anion and cation difference is used to quantify the buffering capacity of a diet. Supplementing the diet with direct microbially that enhances lactate utilizers in the rumen may reduce the risk of subacute ruminal acidosis. Yeast, propionibacteria, lactobacilli, and enterococci have been used for this purpose. There is no specific treatment for subacute ruminal acidosis because it is not recognized at the time of decreased ruminal pH. If necessary, secondary conditions can be treated and you must take your cattle to the vet immediately if you notice any symptoms for better treatment. I hope this information was helpful for you. For more informative videos on cattle health and products, stay connected with us on our channel SwadeshiVIP.